Good afternoon, everyone. Welcome to today's policy address on policy areas of 2024. We have with us Secretary for Home and Youth Affairs, Ms. Alice Mak, Secretary for Labour and Welfare, Mr. Chris Soon, Permanent Secretary of Labour and Welfare, Ms. Alice Lau, and Permanent Secretary of Home and Youth Affairs, Ms. Shelley Lam. The two secretaries will first speak using PowerPoint presentation. Afterwards, the floor will be open for questions. Ms. Mak, please. Good afternoon, everyone. Today I will go over the initiatives under the Home and Youth Affairs Bureau in the policy address. The initiatives are of a wide range, covering youth and women development, family education, building management, ethnic minorities, and district care teams. We aim to improve people's life, better meet people's needs, and build a caring and harmonious society. In terms of promoting youth development, our Bureau announced the Youth Development Blueprint at the end of 2022. It outlines the government's philosophy and direction on our work on long-term youth development. We work with policy bureaus to implement over 160 measures of the blueprint under their policy areas. To keep the measures current, relevant bureaus rolled out close to 60 new measures last year to meet the needs of young people. As at May this year, nearly 80 measures have been completed. Our Bureau has delivered results in a number of areas. The latest ones are the inaugural Youth Development Summit, approval of 4 projects under the subsidy scheme for using hotels and guest houses as youth hostels, launching the pilot scheme subsidy to grassroots youth for participating in exchange activities outside Hong Kong, and the first Hong Kong Youth Plus mobile app. To expand youth facilities, space and network, the policy address this year proposes to convert the community isolation facility at the former Kai Tak runway to youth facilities, such as the Youth Post Hostel and space for cultural, arts and sports exchange to promote bi-directional exchange between young people in Hong Kong and in the mainland. Our Bureau is working with relevant policy bureau and departments on drafting tender documents. We plan to select a suitable body through open tender to operate this brand new facility. We aim to start the tender exercise at the end of the year. The facility will begin operation next year. To strengthen the support for unleashing the potential of young people, our Bureau will revamp a part of the Youth Square to create a new interactive space for young people to interact, tap into their potential and engage in activities. We will also launch the Good Story of Hong Kong Youth scheme. A part of the Youth Square will be earmarked for a video studio for young people to make videos of good stories. Training on video production will be provided. A new round of funding scheme for youth life planning activities will be launched to subsidize eligible NGOs to provide support to secondary school students, parents and teachers on life planning. The focus will be on promoting Hong Kong's edge of being connected with the world and supported by our country, and to help participants understand Hong Kong's 8 centers, national development and planning, the Greater Bay Area, and the accompanying opportunities. The Jockey Club will contribute $300 million to support these 2 schemes. Our Bureau will set up a Youth Link physical interactive platform. It will be on 2 floors in the Nam Cheong Community Center and a part of the temporary market in Tung Chau Street. There will be multi-purpose rooms, cultural and creativity products market, small performing space, etc. The platform aims to provide a place for Youth Link participants to gather and interact. It will also be the base where measures in the blueprint are put into practice and a place for young people to talk and work with the government and the Youth Development Commission. The government will continue with the youth hostel scheme and subsidy scheme for using hotels and guest houses as youth hostels to meet the aspirations of young people to have their own place to live. Currently, there are 6 hostels under the schemes offering 3,000 places. To expedite supply, our Bureau will form a task force to provide targeted support to relevant bodies and to liaise between them and the government so as to launch more hostel projects sooner. In terms of promoting family education and women development, family is a core value of society. The government has been promoting family core values through the Family Council to forge social harmony. Last week, that is, on the 14th of October, a new 5-year funding scheme on the promotion of family education was announced to subsidize non-profit-making community projects in promoting family education. The Family Council and our Bureau will hold the first Excellent Family Awards for families in Hong Kong to take part in. Through sharing of experience in maintaining a loving family, we advocate good family values and reinforce family building, family education, and build a harmonious society. Details will be announced after consultation with the Family Council. The government attaches importance to women's development. In the past 2 years, a number of key measures relating to women have been rolled out. Our Bureau will launch the She Inspires Mentorship Program. Female university students will be paired with mentors from senior management. Training and activities will also be organized. The goal is to inspire young women through sharing of successful experience and guidance to help them plan their future and to groom female leaders. On improving building management. Building management is the joint responsibility of all owners. Good management improves the living environment, promotes community building and social harmony. The government acts as a facilitator, using legal framework and other support to help form suitable bodies, such as owners' corporation, to perform their duties. For free-nil buildings, the lack of organization among owners and tenants means difficulties in handling management issues. Under the Building Management Professional Advisory Service scheme, the Home Affairs Department invites community organizations with property management experience to reach out to these owners to help them form owners' corporations. The scheme started in Sham Shui Po and Tsuen Wan in June 2022. It has been expanded to areas with more 3-nil buildings such as Central and Western, Eastern, Wan Chai, Yau Chin Mong, North, Tai Po and Kowloon City. The pilot scheme proves to be effective and has been regularized and expanded to all 18 districts. The government will launch the pilot scheme on joint property management to improve the management of old standalone buildings. The HAD will consider the number and distribution of these buildings in the districts and consult district councils before selecting several pilot areas. The pilot scheme will start in 2025. Under the scheme, a property management company will be in charge of managing old standalone building clusters in the area. Fees will be shared, so these buildings have access to basic management services at affordable rates to improve the living condition. The HAD is meeting stakeholders on the details. When details are finalized, an announcement will be made. Regarding support to ethnic minorities, our Bureau has been working with district bodies and NGOs through the HAD to provide support to ethnic minorities with integration into the community. In addition to CHEER, Center for Harmony and Enhancement of Ethnic Minority Residents, the HAT will invite another EM support center to provide translation and interpretation service to assist EMs, ethnic minorities, to overcome the language barrier. The goal is to start the service in 2025. 2 new support centers in Central Kowloon and NT East will also start before the end of this year. The existing 8 centers have each set up an EM care team in July this year. For the 2 new centers in Central Kowloon and NT East, they will each set up an EM care team. On the work of district care teams, the district care team is an important service unit in the improved district governance system. 452 teams in the territory was fully operational in 2023 Q3. The teams reach out to serve residents, help promote government policies, and take part in emergency support. To enhance the support to care teams, the government will regularize their establishment and increase the subsidy by 50% in the next installment. The HAD will roll out a Outstanding District Care Team Award. The Chief Secretary will present awards to outstanding teams, members, volunteers, and partners to recognize their performance and to promote the spirit of care. That's my presentation today. Thank you very much. I'll now defer to Mr. Soon.
好啊，多謝麥局長。
Thank you, Ms. Mack. I'm going to spend about 10 minutes on 3 major issues. First, targeted poverty alleviation, then labor, then on social welfare. I'd like to brief you on several schemes. The first one is Strive and Rise program. We'll continue to launch the 3rd cohort and the community living room project. There are a total of 4 right now. We expect another 3, at least three more community living rooms will be put to service. So in 2025, I believe in the first half of the year, we're going to have 7 community living rooms in total. They will be able to help as many as 3,050 SDU households. That is about 470,000 attendances a year. This is very encouraging result. On the school-based after-school care service scheme, it will be extended to 110 primary schools, almost doubling the existing service target of 50. We can help particularly single-parent family. Under the CSSA Comprehensive Social Security Assistance Scheme, many of the recipients are elderly persons in the community. Many of them are elderly singletons and doubletons. If you take a look at the figures, there are about 110,000 elderly people in the community receiving CSSA. They are either elderly singletons or doubletons. 56,000 elderly persons can take care of themselves. They have self-care capability. Regarding their living locations, environment, some 5,600 of these elderly people are living in substandard living environment. They either live in private care homes or they are renting some private accommodations, but many of these are inadequate housing. The living standard is substandard indeed. So if we can provide one more option for these 5,600 elderly people, they can reside in Guangdong. There are residential care homes in the Guangdong province. This is quite attractive to these elderly people. To make this happen, we cannot just rely on the requirements under the CSSA. 4,400 per month. This is the amount they are receiving, and they cannot reside in a residential care home. For elderly people in Hong Kong staying in private care homes, the monthly allowance is about $10,000. If they want to go to the GBA to live in a residential care home, we will give them $5,000 more, so totaling $9,600. This is one more option for elderly singletons or doubletons receiving CSSA. We want to provide them with one more option to improve their living environment. This is what we want to achieve in the 3-year pilot scheme. Next, on protecting labor, I want to focus on 2 main areas. 3 million workers are concerned about the arrangement for offsetting MPF starting from the 1st of May next year. All severance pay and long service payment relating to MPF cannot be used to offset. The employer the government will launch a 25-year subsidy scheme exceeding $33 billion to share our employers' expenses upon the abolition of the offsetting arrangement. We will submit a funding approval to the Finance Committee next month. Next, on the protection of wages on insolvency fund, we already improved the scheme last year. For the first $100,000, it will be covered by the insolvency fund. And the cap is $390,000, with the remainder, half of the remainder being paid by the fund. So most of the people can get 2/3 of the severance pay. For those who have a longer service period, they may not be able to get all that they are entitled to. So we'll consider further increasing the ceiling of the payments to enhance employee protection. I can let you know right now $100,000 and half of the remainder. This is the existing policy. Or we will increase the amount to $150,000. Or if it can be covered by the fund in its entirety, the amount will be doubled to $200,000. We have one target. We want to enhance labor protection. In the interest of time, I want to talk about another scheme. That is the GBA Youth Development Scheme. We used to only accept university applicants. Now we want to relax the requirement to associate degree holders as well. So apart from university students, for those who have an associate degree or a sub-degree, they can also make an application with the GBA Youth Employment Scheme. Regarding the subsidies given to employers, it will be increased from $10,000 to $12,000. There is one requirement, however. The cap is 60% of the wage that young people are receiving. We want to incentivize employers to engage young people. We are exploring a bilateral arrangement. Right now, only Hong Kong young people are going to the GBA to work. We want to allow the same enterprise to arrange for the same number of their employees to work in Hong Kong. This is a bilateral arrangement, and we are studying the relevant arrangements. Regarding social welfare, I'll first talk about elderly people, and then I will also talk about carers as well as support given to PWDs, persons with disabilities. We spend much coverage of the policy address on residential care services scheme in Guangdong. There are only 4 right now, but starting from next month, it will increase to 11, covering 4 GBA cities: Guangzhou, Foshan, Shenzhen, Zhongshan, as well as Zhaoqing. For 6, they are cooperated with Hong Kong. For the other, they are being run by the mainland, so there are indeed many choices. One factor affecting whether elderly people will choose to retire in the GBA is medical care. We want to give them peace of mind. Our country is very good to the elderly. As long as the city is willing to cover the medical expenses, then for those who have lived in the mainland for 6 months, they can already obtain a residency permit. With the permit, they can purchase insurance in mainland. It costs about $100 per month. So for those on the scheme, the government will also purchase these insurance policies for them. There's a co-paid amount. For clinical services, say $100 per time, medical insurance will cover half of the amount, and you will have to pay $50. For hospitalization, however, the medical insurance will pay 70%, and you will have to pay 30%. Elderly people may be worried about the co-payment amount, so we have a pilot scheme. For outpatient services, we can pay as much as RMB $10,000 per annum. For hospitalization, a maximum of 30,000 RMB per annum. Say 10,000 RMB for outpatient services if one has hypertension, diabetes, as well as a poor lung function in general in mainland China. The insurance policy can cover 1 medical consultation per month and drug prescription for a year. All these can be covered by the amount of $10,000. For 30,000 RMB, say an elderly person has a stroke, broken his or her bones, hospitalization for 20-odd days, the amount can also cover the medical consultation. So we want to give elderly people peace of mind, and that's exactly the target of the pilot scheme. We will also visit elderly people to give them help. Locally speaking, we will increase the number of residential care service vouchers. It will be increased from 5,000 to 6,000, so they will have more options. On children, we'll further strengthen child care services. For community child carers, we will increase the figure to 2,500, and there will also be 4 more centers. That is community parents for children, community parents and children centers. In the Southern District and in Chinwan, care teams visit elderly singletons and doubletons, and this will be extended to the entire Hong Kong. We want to better use the resources of care teams, and we also want to show loving care to elderly people. And we also want to build an interdisciplinary and inter-organization database of carers and of elderly persons and PWDs. I'll give you more information in a moment. On supporting PWDs, we will set up a total of 14 integrated community rehabilitation centers. There will be center-based services, and there will also be support services for those who choose to stay at home. There will be an increase of quota, 1,280. That is an increase of 25%. We want to provide more support to PWDs. For peer supporters, we have peer supporters, and we find that this role is very important. So we're going to extend it to support centers for PWDs. We will add 90 more peer supporters for PWDs. And that's all from me. Thank you.
Now the floor is open for questions. If you'd like to ask questions, please raise your hand. When you're named, identify your media outlet. Don't ask more than 2 questions, please. On my right-hand side, the back row, the gentleman in black. I'm from Mingpao. First question for Mr. Xun in relation to supporting elderly people on CSSA to live in homes in Guangdong. Does it include the 11 homes under the Guangdong scheme? I mean to make them designated ones? The subsidy of 5,000, on what basis did you set this? Have you looked into the fees level of these homes? Do you think that they will raise their fees because of the subsidy? In terms of services and medication, will elderly people on CSSA benefit as well? About the increase in funding for care teams, this is a question for Ms. Mack. Previously, the government emphasized that working in a care team is on a voluntary basis, not for money. Why is there a decision to increase the subsidy by 50%? How did you assess the extent of the increase? Is it the case that there were miscalculations resulting in an inadequate pressure support? Was there political pressure? Is it the case that there was insufficient support? I will give you a quick answer before I defer to the permanent secretary. In relation to schemes for elderly people living in Guangdong, they have to choose from the 11 designated homes in Guangdong. But don't worry that these homes will raise their fees, because these homes house local people, not just Hong Kong elderly people as well. And as to the details about how we worked out the $5,000, I'll defer to Ms. Lau. On the 1st of November, there will be an additional 7 homes. The additional 11 homes. Well, they have already given us their proposals for level of fees, so don't worry about any fees increase. For an elderly on CSSA, someone who can take care of themselves for various reasons, maybe they're living by themselves or living with their partner, if they would like to live in a community, they may be staying in Hong Kong, not in a subsidized home. We give them about $9,000 in allowance. If the elderly person moved to Guangdong under the Guangdong scheme, they can get a cash subsidy about 4,400 Hong Kong dollars. If the elderly person wants to live in one of the 11 designated homes, the 4,400 will not be enough. That's why they won't make that choice. if they are living in Hong Kong, they will get 9,000 or so. We minus that amount by 4,400. The difference is 5,000. That's how we worked out the 5,000 subsidy. There is no increase in government spending. By giving them the difference, elderly people can choose to move into designated homes in Guangdong. Out of the 11 homes, a number of them are able to offer full service with the additional $5,000. The elderly person may have some money left for spending. But of course, the homes may be in different cities and there may be different level of fees, so the fees will not be the same for the 11 homes. I can say that more than a couple of homes will be able to provide a full service with that amount. Well, for outpatient 10,000, inpatient 30,000, that only applies to elderly people under the residential care home, with residential care service in Guangdong. That means they have passed our means test. And if they move to Guangdong with the additional $5,000, they are not entitled to the 10,000 and 30,000 because these people can take care of themselves. I will answer questions about the care teams. Starting from Tsuen Wan and the Southern District, we set up the district care teams. Now we have care teams all over the territory. We have 400 or so teams with 5,000 members. They are all volunteers. They have not been paid any subsidies. Some of them even pay out of their own pockets to help. There was a fire at a building, Hua Feng Dai Ha. That was only a few months ago. Residents were affected. That is, a fire at the New Lucky House. Residents were affected and they needed clothes and food. Members of the district care teams provided support. For some, they offered the support from money from their own pockets as well. In the policy address, it is proposed that the service of the district care teams will be regularized. Care teams provide services in emergency situations, and not just that. They provide services such as visits, organizing activities for residents in the district. So far as at August this year, they have visited 230,000 households. They have also provided repair service on 22,000 occasions. In addition, they have organized over 10,000 events and activities of different nature. These activities may be for ethnic minorities where there are more ethnic minorities living in the district, or relevant services. So care teams have achieved the objective, that is, to pool resources together to build a harmonious and caring community. Each care team works with at least one partner. Every time when care teams provide service, they engage volunteers as well. All these parties provide meaningful service to those in need. That's why we have regularized the teams. And for this reason, we need to give them more resources and funding. The thousands of members of the care teams are volunteers. The subsidy is used on the service, that is, the visits, the minor repairs, or activities and services cater to the needs of the community and the district. For the year or so after the teams have been set up, we have received a lot of requests for assistance, and the assistance have been rendered. That's why there is a need to expand the service. A lot of people want to join. They may be volunteers, not necessarily members of the team. They may be partners as well. In a case of, say, a fire or power cut or water supply suspension in public housing estates, the teams offer assistance. There are visits to elderly people living on their own or with their partners. By reaching out to the residents, the cases, if they are in need, will be referred to relevant departments. Next question. Lady in white on the right. I'm from Singtao. Just now, Ms. Mac talked about regularizing the care teams. Will the existing teams continue, or will there be a new round of selection of team members or teams? Just now, Mr. Sun talks about the residential care service in Guangdong scheme. Well, care teams will help elderly people to adjust. Will the selection be from existing care teams, or will there be a new team?
So I'll talk about the continuity of care teams. For those who are serving on the care teams, they have signed a 2-year contract. It's time for us to review the contents of the contract or the agreement, as well as the service scope of care teams. Every time we conduct these reviews, we will also consider whether the groups are suitable groups in the community and whether they meet the requirements for becoming a care team. After we regularize care teams, we will conduct a holistic review of the service scope of care teams, as well as the contents of the agreement. Just now, the reporter mentioned care teams in the GBA. Well, we actually provide caring services, but they are not care teams. For example, we will conduct visit services. Elderly people do not want to be alone, so we are going to visit them in the GBA. For Hong Kong elderly people retiring in the GBA, we will also provide services. I will give the floor to the Permanent Secretary, Ms. Alice Lau. Just now, the Secretary mentioned the first type of service provided by carers in the GBA. We provide caring services through a service provider. We visit these elderly people to show them loving care. If need be, we will also maintain liaison with their family members in Hong Kong. Sometimes their family members want to know more about their life in the GBA, and we can provide this kind of support. For those choosing to reside in a residential care home in the mainland, there is a 6-month period we will provide caring services for these elderly people, even after the 6-month period. For elderly people living in mainland, sometimes they want to return to Hong Kong, for instance, so how can we make the relevant arrangements? We will engage a service provider in mainland China. They will provide liaison and support services, and that's why we call it a caring service. Next one, the lady in dark red.
First question for Mr. Sun. We see quite a lot of policies and substantial investment to better support elderly who choose to retire in the Greater Bay Area. Is the Greater Bay Area now the solution to aging population in Hong Kong? And how would you measure the financial burden that Hong Kong government need to bear if you are going to cover the medical bills of the elderly? And is there any quota? Second question for Ms. Mack. The government is now trying to phase out substandard subdivided flats, but bed spaces like space capsule, they are not included in this new legislation. Is there any plan to amend the relevant ordinance to crack down on those substandard bed spaces as well? Thank you.
Thank you for the question. We are providing more choices at the GBA for elderly in Hong Kong. The principle behind it is an option. So we have always to make sure that we have enough support and places in Hong Kong to cater for the retirement and elderly needs of our own people. But of course, if we can provide more choices for the elderly in Hong Kong to choose on their own to live in the GBA, I think it will be a win-win solution. As for the what we call a medical support pilot program, what we have in mind right now is we're going to provide resources to help maximum of 1,000 such cases. So it's not a very significant amount, but actually because of the cost differential between providing similar places in Hong Kong versus those choosing to go over to the GBA, there's a cost differential. So even if taking into account the co-payment support as outlined in the pilot program, the actual outlay for the government is more or less the same. So this is more or less on the cost-neutral basis. So it won't increase our cost even on the welfare side, but actually if we take into account their healthcare needs, if they choose to stay in the GBA and receive healthcare there, that means their needs and spending here in Hong Kong will be reduced. So in overall terms, we believe for those choosing to make use of this facility, in fact, it might save us some cost in overall terms. But even just for the welfare spending, it will be cost neutral to us. So thank you very much.
Thank you. About bed space apartments, currently we have an ordinance, the bed space apartment ordinance, which governs any premises with bed space with over 11 bed spaces. So after the introduction of the subdivided flats ordinance, we will take into account the updated measures and standards in regard to the fire safety and also the building safety. We will also take into account all these new updates to review and enhance our standards under the license of the bed space apartments. So to answer your question, we have considered about the introduction of the subdivided flats ordinance in the future. So we will take into account the updated standards to review and update our license requirements for those bed space apartments. And we will also enhance the enforcement actions to make sure that the unlicensed bed space apartments will be prosecuted in due course.
下一個提問，右手邊最前白色衫嗰位女記者。
The lady in white in the front. I'm from cable TV. I'd like to ask Mr. Sun, in the policy address, you mentioned having a database for carers. Do you have any timeline? When will the study findings be available? Do you have the same definition same official definition to help these people in need. And the protection coverage will be enhanced with the insolvency fund, the PWIF. Are you worried that there will be abuse of the fund because of the increase in the cap of the ex gratia payments? Thank you for your question. First of all, on the database for carers, in society there is a consensus. We need to make good use of data, big data. First of all, we need to make sure we comply with the personal privacy ordinance. We are just starting. We draw reference from the experience in the mainland. If we have big data, we can identify elderly people and families that have imminent risks. In Hong Kong, 1 in 4 elderly people rather 3 out of 4 elderly people are receiving subsidies from the government. For CARES team to identify elderly singletons and doubletons, we can combine the data we already have. These elderly people are receiving different social security allowances. Apart from social welfare, they are also using many medical resources in the community, so the HA Hospital Authority does have their own information. When will a carer face risks? When do we need to intervene to step in earlier? If there is something wrong with the social welfare aspect, then we will know it. However, on the medical front, we may not be able to identify it. If we could integrate all the data across different databases, we will know the situation earlier. For example, their partner may go to the hospital and we can inform the relevant social welfare organization to visit this family so we can step in earlier to provide assistance. Then we can help them as soon as possible. We won't see anything unhappy. We need to take the first step. We need to make better use of our resources to help many high-risk families as well as carers. In relation to the PWIF, we want to help employees to solve their imminent needs, but funds of the PWIF isn't public fund. Each has to pay $150, and the funds are actually from employers, from companies. They are not public funds. We aim to help companies or employers that cannot pay severance pay. We need to know this amount of money isn't public fund. That's a pool of funds collected through the establishment of companies. $100,000 plus half of the remainder, we can already have a lot of employees. For those with longer service period, they may not get the entirety of the severance pay. We want to help employees to meet their burning needs. If we can increase the amount to $150,000 or even $200,000, we can help a lot of people. We can help 2/3 more cases if the amount is increased to $150,000. If we can increase the amount to $200,000, we can help as much as 85% to 86% of the employees. These employees can obtain the severance pay through the PWIF. The balance on the PWIF is very healthy at $7.3 billion, so it's sufficient for us to do this. If we can help employees, I think we should do this. The decision is with the PWIF to increase the amount to $150,000 or $200,000. Thank you.
右手邊
Next question. The lady on the far right. I'm from In Media. Just now, Mr. Soon said that, well, according to Oxfam, there is 1.39 million living in poverty, and the number is increasing. Is it the case that the targeted poverty alleviation measures is not precise enough? Well, will the government consider resetting the poverty line? Will you offer protection to bogus self-employment, those on bogus self-employment? Will there be redelineation of district councils and reform the number of district care teams? Well, will you consider changing the KPIs? Will you allow district councillors to have more ward offices? Can they have joint ward offices, or can they have their own? In relation to youth post hostel at Kai Tak, will there be a single operator? What is the criteria? Will you require the operator to be from a background of culture and arts? I think that's all questions for now. I would like to first answer the question in relation to poverty. In the past, when we set a poverty line, the concept is simple. We just look at the relative income. But the poverty line drawn on this basis is inadequate. What if you have assets, if you have a property, they're excluded. If you have a car, that's excluded. We are all concerned about elderly people. For households of elderly singleton or those living with their partners, over half of them have their own properties. But if you just look at their income, then the property value is excluded. They are not working, so they have no income. As a result, the government subsidy, say that the living expenses for the elderly will be treated as their income, just 4,000. But the elderly person may have a lot of assets, cars, properties. It's just like if you look at the person's health, you only look at the BMI while ignoring other factors, then that itself is inadequate. So if you need to consider whether someone is living in poverty, you need to look at a basket of factors. That's why we have targeted poverty alleviation measures. We have a lot of measures in terms of education, social welfare, and healthcare that are safety nets. On housing, we have public housing. So on targeted poverty alleviation, we have to select the right group, the group that is at the very bottom. Those living in subdivided units, they may not be in short of money. They need space. They need social interaction. That's why we have living room, community living room, and we have after-school care for elderly people. Then you give them visits. You identify these households. You provide them with services and refer the case if necessary. So if it's just a mechanical approach, the poverty line drawn is inadequate. So it's no longer adopted under our targeted approach. If we are to be precise, we have to select the right group. We select those in dire need. We give them targeted assistance. We tailor-made assistance for their specific needs. Where if they are young, then they need more development opportunities. For elderly people, then we need them better care. Your first question for me is in relation to care teams. In my reply to another reporter, I said that when the teams are regularized, we will review the service scope and service type of the teams. Will there still be 452 teams? We'll have to wait till after the review. We don't simply decide whether we need 452 teams, 442 teams, or 462 teams. We review the service scope. There may be adjustments, but the number may remain the same. In short, we will conduct a review after the regularization. The members of the teams are volunteers. There are 5,000 of them. We will conduct a review on the service scope and types of service. In relation to KPIs for district councillors, after the district councils have been revamped, in order to ensure that district councillors perform their duties, to ensure that residents can use the service of district councillors, we set KPIs for each district councillors. That includes within 3 months of the taking of office, they have to set up their ward office, they have to give us their annual work report, they have to attend district council meetings and activities. The first KPI, which has been met, is that they will set up their ward offices within 3 months. That is not as easy as you think. I've been a district councillor for 2 decades. There has never been a term when a district councillor successfully set up their own ward office within 3 months. When I became a legislator, it took me 13 months to set up my ward office for various reasons. This time round, this KPI has been met by all. It shows that the district councillors are committed, responsible in performing their duties. In this new time, government departments fully support the work of district councillors. That's why ward offices are set up in time. We ask whether we allow them to have joint offices, ward offices. Well, that's different from the objective of improving district governance and revamping district councils. What we do now is we emphasize cooperation among different parties. So the district parties and district councillors will have closer cooperation. If they want joint ward offices, that is allowed. That was allowed in the past as well. In the past, district councillors and legislators can have joint offices as well. At that time, however, there was no indicator saying that you have to offer a certain number of hours in service. But now we have these indicators. So if district councillors would like to expand their catchment area, they may set up joint ward offices. They still have to meet all the indicators. That is, they have to spend a certain number of hours to provide service, and these hours will have to be outside office hours as well, some of these hours. Now I turn to Kai-Tak. I said in my opening speech that within this year we hope to complete the drafting of tender documents. Next year, we hope to have the open tender and for the facilities to be commissioned in an orderly manner. We will make use of the facilities to provide a youth post hostel and to provide space for youngsters to engage in culture, sports, and arts exchange. It is a cultural and creativity base. This idea is conceived, that is the idea of a youth post hostel, because our government would like to provide more opportunities for our youngsters. We would like to promote exchange as well. I mean, youngsters from different places. That's why we have the bidirectional exchanges. In the past, we realized that Well, when it comes to bi-directional visits and exchanges, accommodation is an issue. That's why we would like to make use of the Kai Tak Community Isolation Facility to provide a youth post hostel. This hostel will house youngsters coming from different places for culture, academic, arts exchange. And this will promote and encourage bi-directional exchange. We would like to get youngsters from other places to better understand Hong Kong. And we would also like to help Hong Kong youngsters to broaden their horizons. The government built the platforms for youngsters to do it. Kai Tak is an important location. We would like to make use of an open tender to identify an operator that has experience in running hostels or culture and creativity bases. We want to give space to youngsters to engage in interaction. I think you want to ask about the Nam Cheong Community Center as well. We want to make better use of Nam Cheong Community Center. We want to provide a physical platform for youngsters. We have set up a network in September last year. That is a youth link. We have about 100,000 youngsters in participants. We want to maintain a continuous relationship with them. This youth link is not just a network. It will also have a physical platform. That's why we have plans to make use of some space in the Nam Cheong Community Center. This will be a physical platform for youngsters to gather and interact. Youngsters will be encouraged to make use of their creativity. This will be a culture and art space.
I'm the gentleman. I'm from AM 730. I'd like to ask about the youth post hostel. It's not quite conveniently located. Apart from accommodation, there may have to be new facilities to help young people to get what they need. How can we attract overseas visitors to come to Hong Kong? How much does the administration need to invest in this area or in this project, or will it be subsumed by the will it be borne by the investor? And earlier on, you mentioned a review of the $2 scheme. What is the progress regarding youth post hostel? We want to have a tender exercise. It's rare that we have a location in the urban area for young people to mingle with one another. We do want to develop it into an arts and cultural area. It will be a space for young people to unleash their potential. We also want to leverage community efforts to make good use of locations or spaces in society. We want to turn them into popular space. The reason why we want to turn it into a hostel is that we want to have a location to greet young people coming from overseas so that they will be able to get a better understanding of Hong Kong. It's not the case that our local youngsters live with overseas youngsters when they come to Hong Kong. Instead, the concept is that when overseas young people come to Hong Kong, they stay in the youth post hostel. And they can make academic exchanges, they can partake in different activities, be they arts or cultural or sports, and they can interact with local youngsters. That's exactly how we can foster cultural exchange among young people, and we can also turn it into a popular place. Mr. Sun, well, it's not covered by the policy address, but I understand it's close to your heart. We need to keep the original intent of the $2 fare scheme, and we also need to make sure it's financially sustainable. For the Joyu card, we still need more time to analyze the data about Joyu card. We need to get a better understanding of it. Please be patient. When we finish the survey or the analysis, we'll announce the findings. Thank you. That's the end of the press conference. Thank you.